Hi everyone. Today I'm 5 weeks post-surgery. I have 1 more week to go before I'm allowed to start to put weight on my leg, and I will go quickly through some of the exercises that I do in order to get my full range of motion back and also to fire up my quadriceps. So one of the key things that also you should do before doing your exercise is that if you have access to analgesic, that you should take them in order to decrease the pain threshold before doing during your exercises. And also today I'll be doing some flexion exercises, and it's very important after you finish those exercises that you also do some extension exercises because you don't want your knee to get stiff. So one of the exercises that I do is that you have any belt that you can use. You will tie around, make a small tie, not like here, and you will put it around your feet and you will start pulling. And as you can see, I have some improvement compared to last week. Now I'm almost like at 100-degree bending, which is not bad. Last week I was almost like around 80 degrees, so that's good. And you start pushing until you start feeling a little bit of pain, like around 5 out of 10 pain, and you stand still for a little bit, 1 or 3 or 4 or 5 seconds. Then you start extending again. And as I said, it's very important that after you finish this is that you extend your knee, and so on. You can keep doing this for as much as you can, and at the end you extend. Another exercise that I also started doing, I have done some of it also last week, is strengthening for your quadriceps. So basically, if you have some of those rubber bands that can add a little bit of a resistance to while doing the exercises, it's good to have one and use it. So we will do leg raises. Stand on your back and you will start lifting your leg up and down, up and down, up and down. So that's also one exercise that you can do. You can do as much as you can, 2 or 3 sets. Each set is 10 times. And again, after you finish, you can also do some straightening extension exercises. Another exercise that you can do also is that you can sit on a chair or anything that you can, and you start bending your knee, and as soon as you start feeling this a little bit of pain, you stand still for like a minute. You stand still and you extend again. That's also very useful for getting back your range of motion. And you bend and you extend again. And so many other exercises that you can do. Usually before I do these exercises, I do around 10 to 15 minutes on the bike. I try to slowly push with my other leg and just let my injured leg go with the flow of cycling, and in order to loosen my leg a little bit before going through my exercises. You can always do ankle exercises and ankle pump with or without a resistance, so you can use the rubber band around your leg like this, and up and down, up and down, and also to the outside and with the inside. You can do 2 sets of 10 each, and that's also very useful to build up the muscles of your legs again. So that's all for this week, and hopefully by next week I'll be allowed to walk and do positive motion exercises, and it will be different from what I'm doing today. Thank you.